Hi, everyone. Welcome. Thank you very much for joining us today to this virtual roundtable to discuss how we can use the lessons from the Ebola response to address the current COVID-19 crisis. My name is Charlene Burton, and I'm the Executive Director of Search for Common Ground Europe. Today, we're going to be hearing from two panelists, whom I will introduce to you very shortly. But before we begin, we're just going to take 1 or 2 minutes to be sure that everyone has a time to join this webinar. So let's just wait for a few minutes. Good, I think we're ready to start. We have 70 participants so far from all over the world. So hi again and welcome again. Thanks for joining us to this virtual roundtable. Today, we're going to be hearing about the link between conflict and coronavirus crisis and what we can learn from the Ebola response and the Ebola work that Search for Common Ground has been implementing. Before I start, I'd like to provide some practical tech-related information. Please, first of all, note that this session is being recorded and will be posted on our website and shared on social media. The list of participants will not be disclosed, but if you do ask a question during the Q&A session, then your name will be visible for future viewers of the video. You may know that GoToWebinar allows you to choose what your screen is displaying. And at the top left of your screen, you should see a drop-down menu. It's showing on the presentation with different options for display. And I encourage you to choose the display all so that you can see all the speakers and the presentation at the same time. There is also a slide bar that you can move up and down to increase or decrease the size of the PowerPoint presentation. And lastly, each of you has been entered into the meeting as muted. Therefore, I'd like to point you to the chat and question box to the right of your screen. This is the tool that we're going to be using to take your questions and your comments. And we will start to take these questions towards the end of the panelists' presentation. So hi again, I'm Charlene Burton. And today we're speaking about health and peace building. In many ways, the current COVID-19 crisis poses one of the greatest challenges that many organizations and peace builders around the world will have faced to date. And it's difficult to overstate the strain of this pandemic on societies around the world and the challenges ahead for many in the international community. To date, there have been nearly 2 million confirmed cases, reaching almost every country in the world. Already, the coronavirus pandemic has taken seismic toll on the public health and economic well-being of many countries. As it spreads beyond the higher income and higher governance capacity countries where it hit first hard in Europe and the US, it's going to become even more true in conflict-affected states where pandemic response will struggle with different factors such as low state capacity, political violence, marginalization, high level of civilian displacements, and low citizen trust in leadership. Not to talk about the economic downturns triggered by the disease that will only worsen its effects on global stability. Welcome to those who just joined. My time at Search began back in 2011 in the Democratic Republic of the Congo. It's a country that we're going to talk about today. At the time, I was managing a conflict sensitivity project, working hand in hand with humanitarian actors to ease their access to the most vulnerable communities by doing social cohesion work. In 2013, I moved to West Africa to manage our programs in the region. And then in 2014, as did many of us who were working in the context at the time, I faced very challenging endeavors when I had to work with my Liberia, Sierra Leone and Liberia and Guinea colleagues to tailor search response to the Ebola crisis. All of us at the time were feeling a mix of anxiety, of fear and uncertainty, but also an agency and desire to contribute. We knew that obviously we were not a medical organization nor health practitioners, but we felt from deep down in our hearts that as Peacebuilder, we had a meaningful and relevant role to play in preparing and implementing the response. My personal experience from the DRC working on conflict sensitivity of humanitarian aid helped tremendously in designing that approach. Throughout this experience, it really became clear to me and to my colleagues that in times of extreme health crisis in conflict areas, the medical and humanitarian responses and peacebuilding are really the two sides of the same coin. They must be navigated and implemented in tandem, and we hope to bring these insights to bear in our discussions today. 13,000 people lost their lives to Ebola since 2014. The virus changed the local environment by challenging values and beliefs and cultural norms, but this may be little when compared with what is coming up with the new coronavirus. One can only anticipate the magnitude at which it will change our world. Search for Common Ground is an international NGO doing peacebuilding. We have 800 staff working around the world in 30 countries, including Africa, in Africa and Asia, Europe, and the Middle East. And because of the nature of our work, de facto, we have been working hand in hand with humanitarian and health actors in some of the world's most complex contexts. We can move to the next slides. Today, this discussion will be threefold. First, we will be drawing from Search's experience, navigating these challenges in the challenges and the response to the Ebola in West Africa and in the DRC. Then our panelists will outline how they have been revisiting the existing peacebuilding programs or designing new programs to adapt to the new norm and respond to the pandemic. And lastly, I'm going to ask them to offer some guidance and some recommendation on how we can tackle the spread of coronavirus in conflict-affected and fragile conflicts. I'm lucky today to be joined by Lina Slackmulder and Laurent Cassindi. Laurent is the Global Program Quality Specialist. He's based in Brussels, but before moving to Europe a year ago, Laurent worked for Search in the DRC for a decade, where he was a program director based in the Kivus. In that role, he provided technical support to the frontline staff and helped design Search's response to the Ebola crisis. To this date, he remains actively involved in Congo's social fabric. Lina Slackmulder is Search Senior Vice President of Programs based in the USA. She oversees the management of our programs across the globe, ensuring that our methodologies and tools are tailored to each context in which we operate. She was actively involved as such in the design of our Ebola response in West Africa and also in the design of Search's Peacebuilders approach to tackling epidemics. They will be presenting for about 20 minutes, then we will use the remainder of our time together to take your questions, and the panelists will do their best to respond. Please be reminded that there is a chat and question box to the right of your screen, and I'm also kindly reminding you that this session is being recorded for future posting on our website and on social media. Lina, let's start with you. Could you please tell us about the challenges that the West African countries, Sierra Leone, Guinea, Liberia, have been facing with the Ebola virus disease, and how Search for Common Ground responded to this?
Great. Next slide, please. Thank you, Charlene, and welcome everybody. So glad we can have this time together. So this is a picture of the son of Reverend Moise Mami, who was among 8 people killed quite violently in September 2014 in part of the Région Forestière, the forest region of Guinea. As these health workers and awareness raisers, religious leaders, government leaders went out to this village to raise awareness, they were met with a hostility that shocked the country and the world. And it was just one indication of the challenges that this region was about to face in tackling Ebola. Next slide. It reminded us that, in fact, across Guinea, Liberia, and Sierra Leone, there had been a history of war, and there was a very poor relationships between the government and civil society. The first case of Ebola came from that forest region in Guinea, which had been traditionally marginalized despite having the large natural resources of the country. And so information coming from the capital Conakry was seen with suspicion and mistrust. This was similar in Sierra Leone, where identity politics were playing out. And people in the north felt like maybe they were being targeted by the government because they hadn't voted for the current president. And in Liberia, it came at a moment when there was increasing frustration by the Liberian people about allegations of corruption and abuse of power by the Sirleaf government. And so the whole communication effort around Ebola was viewed with incredible suspicion, as though it was a punishment against certain existing marginalized groups. The health systems were weak because of the history of war. And then one more layer was that there were many traditions and customs that the initial efforts to try to speak about Ebola and raise awareness didn't consider. Some of those were related to people's religious practices, and others were related to their customs. And so they felt in the way that the initial efforts to raise awareness about Ebola were done, that it was violating their dignity and that it wasn't respecting who they were. So this led to an extreme sense of mistrust, denial, and even conspiracy theories. You know, when Ellen Sirleaf Johnson actually called upon the US for urgent medical help, and that was accompanied by the US military who came to secure the delivery of those services, that sparked a huge conspiracy theory that in fact this whole thing was simply about Ellen Sirleaf Johnson trying to remain in power. So that was the challenge that we faced when we were trying to ask ourselves, how can we help? Next slide, please. So the response that we took as searchers, given that we'd had more than a decade of relationship with communities, we had these very popular Talking Drums production studios, which had been producing radio drama and youth programs and all kinds of things, was to focus on asking the question, how can we enable the real information about Ebola, what it is, how it's spread, and in particular, how to take care of people when they get sick and when they die. And we activated all of these different networks of credible communicators. That meant town criers, that meant community radio station, that meant motorcycle taxi riders, that meant a partnership with the pharmacy board in Sierra Leone, where we deployed public booths and broadcast PSAs and went out to markets. In Guinea, we created a synergy of media, meaning that we took media whom naturally were reflecting different political perspectives across Guinea, and we had them all work together to broadcast the same information so that there was a buy-in by both those journalists and the listeners of those stations about what Ebola was and how people could keep safe. We recognized that civil society had a critical role, but as I said a moment ago, the relationships with government weren't necessarily strong. So in Liberia, we put together and chaired a task force of 35 civil society organizations that ended up being key interlocutors with government, with international agencies, with international assistance. And that group created what we call the Ebola Situation Room, which then made the link between international and national interventions, the civil society, and the media. In Liberia, we also recognized that as the conflict, as the Ebola crisis was prolonged, that there was a real risk of people not being able to access education. So we worked with some trusted education partners and began to put learning on radio for different young people and supporting different curriculum. And then lastly, I'd say that we recognized as people went from being ill to the treatment centers to being healed, that there was a real challenge about accepting and understanding that people could be cured, that they could actually go back into the communities. And we began a whole stream of work about handling the stigma of survivors. Next slide, please. So we asked ourselves, if we look back on this now, and we ask ourselves, did it work and what did we measure? I'll say two things. On the one hand, because we took an approach that we at Search call the common ground approach and trying to understand how behavior change could happen through trust, through relationships, by not only getting to the rational part, but also to the heart. Well, in a lot of ways, we were measuring many of the same things that we would ordinarily measure as we try and transform conflict. Is trust being built? Are rumors being mitigated? Are we being able to tackle the stigma? Are we seeing that because of the efforts we're bringing, that the behavior change is stronger because of people having received information from community radio stations, from religious leaders, or from community traditional leaders? Do we see that the behavior change is more effective when we're using those channels? We were also measuring whether or not there was a change in the relationship between civil society organizations and government as Ebola came to a close and people began to say, how can we make sure that our health systems are capable of handling this? And then lastly, in that stream of work that actually is ongoing up until today about the reintegration and the acceptance of survivors and the recovery of the health system, how can we measure that there's been that collaboration and that people feel that their network, their traditional network of socioeconomic support has been restored. So I'll end there and look forward to participating later in the conversation. Thank you, Charlene.
Thank you very much. Yeah, we're hearing a lot of from the context, this mistrust, this marginalization, the issue of suspicion towards the central governments. Those are also factors, Laurent, that I feel could be applicable to the DRC. Do you want to share a bit with us whether you found the same context and the same challenges when the Ebola virus disease appeared in the DRC in 2018? And if so, did you just apply the same recipe that we use in West Africa, or were there some elements that needed to be adapted?
Yeah, thank you, Charlene, and you're right, there are some similarities. So in 2018, when the DRC was confronted to an Ebola outbreak, that was the 10th time that the country was confronted to that situation. But this was happening this time in a particular region, which is like we were living a lot of people. But the particularity was the period of this Ebola outbreak. Let's keep in mind that the Beni region is densely populated, and it had been confronted to long-lasting humanitarian and security crisis. And the region was a field of operations for dozens of armed groups, including one of them, the ADF, which used to be accused for conducting attacks against the civilians. In this context, the local communities had a limited trust in the non-national authorities based far away in Kinshasa capital, for the reason that they were feeling that they were abandoned in that insecurity, and they were not receiving, they were not seeing the level of efforts that they could expect from the government to put an end to this situation. So people were mostly trusting their local leaders, traditional and religious leaders in this context, and some of the locally elected officials based in Kinshasa. I also think that the timing of this outbreak was highly challenging. It happened at the moment when the country was running a crucial step of the electoral process. And because of this electoral process having been postponed 2 times in the past, so there was a kind of suspicion by the communities that the regime of President Kabila would use the Ebola outbreak as an excuse to cancel or delay the elections once again. All this created a context of political resistance, leading to attacks against the response teams, and sometimes there were cases of burning the treatment centers. Now, how did we try to respond to this situation? Next slide, please. So this is what we tried to do just to be adapted as possible to the context. We already knew that there were accusations of what people call the Ebola business, pretending that the team, the responses teams were making money on the sufferance of the communities. So to address this problem, we invested our efforts in raising and increasing the capacity of the response actors in conflict sensitivity and how they can operate in humanitarian being conflict sensitive in humanitarian context. We also built the capacity of some of the local leaders who were invited to our training sessions on the common ground approach. With the political leaders, some of them were living far from the region in the Kinshasa, in the capital. So we had already noticed that they were coming out with different positions regarding the outbreak, depending on their side. So we conducted a track 2 mediation. Some of the sessions were happening very far from the field, just to try to make sure that the political leaders would overcome their disagreements to come up with a message which would not be contradictory and which would save lives in the region. We also engaged youth and women associations and tried to empower them so that they could play a role within the communities to raise the awareness about the outbreak and share credible information with the communities. We paid attention to some of the marginalized groups, including the IDPs, the displaced persons, and also some of the minority groups existing in the region. And lastly, we, as always, do a lot with media. So we knew that there were many radio stations in that region, and probably the reason why they were not involved that much in the response it might be because most of them are owned by political leaders. That's possible, but we decided to trust them, to strengthen them, to give them the capacity to be responsive to the situation and to practice journalism, which is conflict sensitive. And this is why we decided to bring them together and encourage them to coordinate their coverage of the response via a media synergy. We also had some youth-led radio programming, which supported a lot to counter the spread of rumors within the communities, especially within the youth categories. Next slide, please.
So am I right
Yes,
to say
please.
that the approaches has been quite similar to the one that we're seeing in West Africa, right? Was the media synergy engaging political leaders, but the main difference there is that in the Kivus and in Ituri, where the Ebola crisis erupted in the DRC, they were already active conflicts. So that's really the main difference with West Africa. Is this correct?
Yeah, exactly. That's the point. And there are some dividing lines which might change a little bit in this context because of being attacked many times by different armed groups. So the different ethnic groups and the different categories of the population were also divided, but around a complexity of dynamics, which was also reflected in the way that many political leaders coming from this region were behaving, and they were denying sometimes the outbreak, even from the main cities in the country.
Okay.
Okay, let's very quickly say how we were able to say that it was working. How did we measure the impact of our efforts? So let's talk a little bit about the attacks on the treatment centers. It was known that many months at the beginning of this outbreak, there were reported many cases of attacks and burning of the treatment centers. So one of the ways we were able to see that our efforts were paying is when we noticed a decrease of the attacks during a period of time. And also when at a certain moment, they all ended with an impact on the effectiveness of the response. We also noticed, because it was during a period of electoral campaign, that most of the political leaders coming from the capital or the other cities arriving in the region, they shifted the way they were talking about Ebola, due to our efforts in drug mediation and all the informal discussions that we have been conducted targeting them. So they were now arriving in the city, and as part of their campaign, they were now contributing to the messaging about Ebola and encouraging the populations to adopt the preventive measures. We also had many cases of some youth leaders who was in front line radically opposed to any effort related to the Ebola response. And this is once again how we saw that we were making some progress, because we had created a platform of youth champions, which we call the change makers. And at a certain moment, we're tracking the profiles of the young people who decided to join the platform. And when we noticed that some of the most extremely opposed to the response were now joining the platform to express their ideas, sometimes also to express their frustrations, we could consider that as a progress in the way we're addressing the outbreak.
Thank you.
Yes, Charlie.
Sorry. Yes, thank you so much. So, yeah, obviously some of the indicators that you're showing we're already recognizing from the attacks on treatment center. I think, if I'm not mistaken, there were over 200 attacks conducted in the DRC on treatment centers. So, as we're envisioning the response to COVID, can you tell us, because this is most likely to also happen, and we've already seen this in Cote d'Ivoire last week, for instance, an attack on a treatment center. Can you tell us what are the lessons that you feel we can apply to this response to this new virus, even though Ebola is not finished yet, unfortunately, in the DRC, but what can we learn from it in the short term and in the medium term, and on how to respond to this new virus, Laurent?
Thank you, Charlene. I will give some reflections about the short-term response that we see and some of the lessons that we have learned. I think there is a key point which is around the information management. We are already seeing everywhere across the world that what is happening when there is a lack of information, when there is misinformation, when there is spread of rumors, and how it can negatively impact the response and the prevention of the outbreak. So we see there is a risk of stigmatization, which is already going on sometimes in some spaces. And we see some groups and individuals, are divided or set apart. And we think there is something we have to do rapidly to respond by leveraging existing platform. The point here is, in this context, it will not be possible to create new spaces and new platform, but you mostly rely on the existing platforms. But beyond the platform, let's also pay attention to the messengers. We have learned from different experiences in the past that it's quite easy to develop a message and send it out, but it's more difficult to create trust. So you can have the message on one hand, and you want to send it to the community, but you cannot rapidly create trust within your messenger. So what we have to do is to use the existing trusted people within the communities and to collaborate with them and to send them out as the messengers. We can also have a lot to do around social cohesion. We all know that the COVID-19 will bring divisions to the surface in some countries and in many countries. We also recognize that in many countries, people have a limited trust in their governments. And as part of this, we should try to find a way in this context of social distancing to use the remaining options that we have to prevent dehumanization and polarization. We can also increase self-awareness about stereotypes and promote empathy. There is still many things to do about amplifying and building positive relationships across dividing lines. And lastly, a few words about conflict sensitivity. There is generally an assumption that wherever there is a need, and you bring an aid, it will always be welcome. But we have also learned from previous experiences that it doesn't work that way all the time. If the response actors have a limited understanding of the context and the conflict dynamics of the region, then they are at a high risk of being rejected, or exacerbating some of the existing conflicts, or just not being welcome in the community. So we think there is a way people should be prepared, have a better knowledge of the context, and be prepared to operate in conflictual zones.
Thank you, Laurent. And I'm going to move on to Lena, but before I do so, this is going to be the last section of the presentation part of this session. So I'd like to encourage the participants, if you have a question, if you have a comment, please feel free to type it in the chat box to the right of the screen so that we can follow up afterwards with trying to respond to your questions. So Lena, Laurent was talking about the short-term measures as we're preparing. Donors, health ministries, and states are preparing the response to COVID-19. Can you tell us a little bit more about what we should keep in mind, both from the implementer side, but also from the health responder side? What should be kept in mind to prevent destroying the social fabric, to ensure that we take conflict dynamics into consideration in the medium and also the long term?
Yes, absolutely. And remember, we're talking here about countries that we know are fragile, that have a history, that are in active conflict, coming out of active conflict. And so all of those infrastructures and that trust is fragile. And so in that context, we see that the measures that are being put in place in terms of lockdown could end up justifying further authoritarian approaches to governance. So in order for us to be sure that our efforts beyond the immediate sort of sense of let's make sure people understand what is COVID-19, how to social distance, etc. Let's recognize that we need to be cautious about a shrinking civic space. The security forces are being deployed in places where they hadn't been for quite some time. They haven't necessarily been equipped about how to use what kind of measures to enforce these lockdowns. So let's see whether or not there's ways that we can, through virtual engagement and online discussions, talk with security forces, with civil society about what kind of role they can play. That would be helpful. We're seeing that in some places, again, where the governance is fragmented and where a central government does not have control over its entire nation state, that there's an opportunity for more recruitment by non-state armed actors, and in areas that they control, an active attempt to conceal the fact that the virus exists as a way of bolstering their reputation. If we're moving into places where we're trying to enforce lockdown, we know that gender-based violence can be aggravated during these moments, and there's been some excellent initiatives to make sure that hotlines and other information is even more available for people to reach out when they may have less freedoms and thus less safety. And then lastly, the blaming of foreigners and minorities, as we heard already, has already started. And so there's no reason that as we move over these next months and possibly over the next year into these measures to try and contain COVID-19, that those factors will only be aggravated and amplified, because people will be missing those opportunities that usually get them together and seeing each other's shared humanity. So these are things to really consider by peace builders, by development actors, by government, civil society, security forces. In all of these areas, we need to recognize these risks. Next slide, please. And in other fragile contexts, today we've talked about West Africa and the DRC, but we are beginning to see already what this looks like in some of the most fragile parts of our world, where there's fragmented governance, where there's low legitimacy, where populations are conflict displaced, and where, in fact, where there was peace negotiations, these things are stalling. I put a quote in here from a report by the Carnegie Group this week, which said that some of the Houthis in Yemen were saying it's better to die a martyr in heroic battle than dying at home from the coronavirus, and that being in a battlefront is safer than being crowded in towns. In Libya, people have been militarizing the response. In Afghanistan, Taliban have accepted a ceasefire in the areas that they control, but not in other government-controlled areas. So there's a lot of opportunities that are showing up in these fragile countries that could actually aggravate the situations as a result of the efforts to counter coronavirus. Next slide, please. And so I want to just end by saying that, this moment where the world is in such turmoil and where we think that it's breaking down so many things in our society is an opportunity for a breakthrough. And I want to just offer 3 last things for us to think about and really look forward to the conversation just now with all of you. But this is a defining moment for young people. We have seen through Peacebuilding how important young people are to making these efforts durable, to changing norms, to transforming institutions and structures and systemic violence. We need to recognize that in the way we think of the COVID response. Secondly, what we've talked about today and why the Ebola response was so hard, it was because there hadn't been trust and legitimacy in each of these post-conflict scenarios. And thus the response was so much more challenged. So as we look towards a longer term perspective, let's build an architecture that's interdisciplinary, that brings civil society together with religious leaders, together with government, with security forces, and build a recovery that's inclusive. And lastly, we do see that this moment in time could be an incentive for ceasefires. And this is an opportunity that all of us, in whatever sector we're in, should try and ask the question, if I'm offering funds as a donor, how might that incentivize a ceasefire? If I'm supporting a health effort, how might my efforts incentivize people to lay down their arms during this period? Because what we've seen as peace builders is that when people can lay down their arms in a moment when there's an opportunity to build trust in a common venture of fighting COVID, that could build the trust and relationships that we could harvest later on in the peace processes. Thanks, I'll stop there.
Thank you so much. Thank you to both of you. It's really fascinating. I'd like to, I'm seeing we have now about 160 participants and we have a lot of questions that are coming in. So I'll jump directly into the questions from the list. And my colleague has been bringing me some questions forward. We'll try and answer as many questions as possible. Laurent, I'll take this question for you. It's a question from Mary Dalsin at GHR Foundation. And the question is really about the coordination with the World Health Organization. But I think maybe we can expand to not just the World Health Organization, but with health actors. Obviously, we don't want to step on the toes of the medical responders and the health NGOs and the health authorities. But can you speak a little bit about how we coordinate the response with health workers to be sure that we're providing a timely effort to support them, and also to be sure that we're using the resources properly?
Yeah, thank you, Charlie, for the question. So I think about the coordination, we should firstly recognize the different expertise. In responding to a pandemic or to an outbreak, even if we have the expertise in communication, in putting in place media synergy, for example, this is the piece of work that we can coordinate. But where does the message come from? What can we communicate about? How do we make sure that we're not bringing more confusion or complicating the work of the health workers? This is where I can say in some cases we were coordinating and investing our efforts in coordinating the communication side of it, bring media workers together. But on another side, we're also joining the coordination platform that was existing, the place where all the pieces of this response could stay together. And in case of lack of this coordination, it was just not possible. And all the work that we could do would cause more harm if not well coordinated.
Thank you. And am I right also to say that in as much as possible, we engage with the relevant authorities in planning the response to be sure that we're either supporting them, sometimes filling some gaps, but also responding to their planification with regards to what needs to be done where, and if relevant, sometimes also some clusters in some humanitarian settings.
Yeah, let's say, for example, in the DRC currently, in responding to the COVID, we have many stakeholders, but the biggest one are like the crisis committee, which is put in place by the government, and which has some channels of communication and management with the government. But we also have different persons taking different initiatives. There might be medical persons, but you can also have some, I don't know, local associations taking initiatives, and we have the media on another side. So we need to find a way to bring all this together. When it's possible, when there is an existing coordination mechanism which exists, we just join that one. But we have noticed even recently that people keep talking about coordination of the response on the medical side of it, and they forget totally the coordination of the communication, and forget totally the coordination of the conflict sensitivity side of the work.
Mm-hmm. Yet we're seeing how much rumors can be having so negative effects on how the health workers are able to respond. Lina, I've got a question here from Rory Anderson at the State Department. And the question here is on how best to engage youth and religious leaders, and what are some of the ways to build their trust in responding to that health crisis?
Yeah, I think that it's interesting because, as we heard, the youth and religious leaders can be part of the problem or part of the solution. And so I think there's a way to identify what are actually the reasons why either young people or religious leaders are not accepting the medical information. Understand what might be threatening to them in terms of what constituency they think they might lose, in terms of what status or position or reputation they feel is at risk. And engaging with them in that way, as opposed to just trying to sort of order them to go out and push out messages, is a really critical stage. If you're finding that, whether it's with young people or religious leaders, that there is obstacles to them embracing and taking forward the right health messages, then the best thing to do is find others in that same group of young people or religious leaders who can then engage with them and offer a safe space for dialogue, so that people can begin to unpack and unfold why it is that they're resisting being part of the awareness raising efforts. So those are some lessons that we've learned.
Thank you very much. And we've seen, I see here that we have a question from Sylvia Brown from the Islamic Relief Worldwide. And I know that this organization, but other organizations with a religious background have also offered some guidance to religious leaders on how to approach the crisis, right? From a religious perspective, from sacred text perspective. So I'd like to read Sylvia's question. She's asking, what are some of the differences between COVID and Ebola in terms of its implication for conflict and fragility? And Lina, I'll ask you that question again, and then I'll have another question for you, Laurent. But how do you see, obviously those are not the same health crisis, the same symptoms, and also the guidance that we're receiving on how to prevent getting the disease is also different. How is this affecting how we're working and preventing this?
So I think that one of the main differences between Ebola and COVID is that Ebola was hardly hitting a couple regions of the world which were very vulnerable and which were in many instances already, poor or extremely poor. And thus it was clear that it was going to aggravate further destitution. Whereby COVID, I think, is hitting parts of the world where people felt as though they were ready. They were sufficiently resilient from a socioeconomic perspective. So the effects of that collapsing economy in terms of how we understand people's readiness, whether it's from a political perspective or from a business perspective, to persevere with what the medical authorities are saying we need to do, means that there's a greater challenge of reaching a collaborative response. whereby before it was like, let's get the humanitarians to help in this particular part of West Africa, let's bring the military in. Now, this is a much larger conversation that requires much more understanding of all of the different perspectives, because they're not reconciling what the medical authorities are saying, what businesses want to do, what security forces think needs to be done. So I think it's a greater challenge for collaboration.
Thank you. Thank you, Lina. Laurent, we have another 15 minutes, so time to take another few questions. We have a variety of people online who are asking us to give some examples of how marginalized communities have been experiencing the outbreak and whether we have been responding differently. Can you provide maybe some examples? I don't know if there are some ethnic or linguistic minorities and how we or other actors have been approaching these minorities differently.
Yeah, thank you for this. So once again, I think this is something that Lina already mentioned. What we have learned with the Ebola, it's going to be quite similar with the COVID, is the fact that people will be affected differently depending on their, existing situation. So those who have an employment will be affected differently. Those who are in displacement in refugees camps will be affected differently. And even if there is a general measure which is sent out, asking people to react in this way or not in that way, it depends on what they have in hand to be able to follow or not. Let's take a few examples. During the Ebola outbreak, we knew that people were encouraged to practice some preventive measures. But how was the message developed to reach out to those people? If we are spreading messages on radio station, that's fine. But how do the minority groups living somewhere in the park, access to that message? In which language this message is developed? And what are the channels that exist to make sure that those people will get that message? This is the first piece of it. And concretely, we went beyond the classic channels of communication. We went until the moment we organized in some of the intentionally targeted communities physical activities to make sure that they were understanding the message, and in field to have with them concrete conversations and sharing about their concerns about the outbreak, instead of just spreading a general message that we're expecting that every category of the groups will understand.
Okay, and so in terms of search response, you're saying we went physically there. I think we've also been doing a purposive effort at declining our radio program and our messages in all the different languages that are available, and sometimes using also alternative methods, not necessarily the physical exchanges or the radio program. You were saying that we have some networks of partners, networks of civil society organizations, religious leaders. Can you speak a little bit about how we're engaging with them in order to reach some minority groups?
Yeah, when it's about media programming, the key point is what are the voices that people can listen to on the program. This is one of the key points. So there is a way that you can have your message in one hand once again, and you put it on air. But people don't necessarily feel very close to the one who's speaking. So there is a point here with the language, but also even with the characters. When we develop characters, for example, with radio drama, in order to pass message, we always pay attention to have a character which resonates with the profile of even the minority groups, instead of only focusing on the main characters that people know about. Let's also do not undermine the fact that there are some kind of social categories which are in place. And most of the time, if there is a conversation happening somewhere, if we create a platform of youth leaders and youth champions, if we create a platform of a network of women leaders, if we don't intentionally target some of the minority groups, they will never be represented. So we use to intentionally set up the average of the representation and go to those people and encourage them to be with the others around the table.
Thank you, Laurent. I'm one of the topics that comes back in the comments is about trust building. And so when you're talking, Laurent, about reaching out to the minority using their own language or their own ways of communicating, it's also a way of ensuring that we have a trusted messenger. And some of the comments, I'm seeing a comment from our colleague in Nigeria saying that because of lockdown, the implementation of the lockdown is also being supervised by security forces. And these security forces may abuse their powers because people are unable to really lock down. They need to get out to eat every day. And therefore, because of a very strict response from the security forces, it also reduces the trust. How do you go about this, need to reinforce the trust in the state authorities, but at the same time, in some more authoritarian regimes or where there is an abuse of power, this reduction of trust happening? And similarly, and this question is going to be for you, Lina, and similarly, how do you go around the issue of politicization of all of this virus disease? We're seeing a lot of politicians taking advantage of this crisis to build their own credibility or their own visibility. That can also reduce the level of trust in the political elite. How do you reconcile this, Lina?
Yeah, thank you. I mean, I think one of the reasons why we're having conversations like this is to recognize that these two aspects, potential abuse by security forces, potential zealous authoritarian patterns, and then political manipulation, that is part of the landscape, right? It's not like that's not going to happen. So the question is, as change makers, as people who are on this call, who are running foundations, who are practitioners, who are researchers, what can we do to influence that, right? So for example, if we know that we're in a country where that security force is either faces a trust deficit or could be abusive, well, now's the time to make sure that we're resourcing and activating space for dialogue between civil society, if it's a community security architecture format or what that might be, to recognize that this might go on for a while. So let's not just wait until something really bad happens, at which point trust is at its lowest. And let's already begin to initiate, how can we help communities to understand what the role of the security forces is? How can we open up conversations within the security forces to say, hey, you're going to find this and this challenge. How are you going to deal with it? Radio and other online communicators are critical because once again, once there is a massive human rights abuse, people will immediately go towards a shaming and blaming approach, whereby we have an opportunity now to open up that conversation because we can see it coming, right? And similarly, we might not be able to stop every politician or every non-state armed group leader from wanting to make this conflict profit their agenda. But we can enable people to be aware that that's what's happening, to be able to make better choices about whom to listen to. And as I said earlier, there still may be an opportunity to tackle this breakdown as a breakthrough and see whether or not some of these non-state armed groups might be able to feel as though they can win by showing up in a different way in a newly framed peace process.
Mm-hmm. Thank you. And I guess there's also all an aspect of education of the civilian on recognizing when they are being maybe manipulated by their elites, when they're receiving information that may not be accurate. We're seeing a lot of spreading of rumors and false information. And this is also what's increasing the polarization between the different components within I was going to say where we're working, but actually across the globe. It's a global trend. We have a question from a practitioner from the Danish Refugee Council, Maria Land. She's asking how we can really adapt the programs to a rapidly evolving context. And so specifically, and I think, Laurent, this is going to be for you, what are some tips for practitioners for incorporating conflict sensitivity into the assessments that the humanitarian actors are doing, recognizing that they are not peace builder and they may not have huge extra resources to hire peace builders to support them? What can they do at their level to already, hit the minimum requirements to be sure they're conflict sensitive?
Yeah, we have been seeing recently that many companies were asked by the government to shift or to change or the way where they're producing things in order to support the response. So we have seen in many countries people, starting producing facial masks, for example, even if it wasn't at the beginning their expertise in their production. I think there is a lot we can get as an inspiration from those people. And I've come up with some kind of 3 tips that I see in this situation. Most of them, they shift, but they don't go very far from their competencies and existing capacities. So even if you make a shift, you don't go very, very far. You try to go to something which is very close to what you were doing in the past. What I've also noticed is that for many of them, they are taking the time to bring in external expertise, ideas that they don't have. There is a place for collaboration. Let's take a concrete examples. Now we are mostly talking about teleworking, moving to virtual activities, but how does it work? How many of our organizations are prepared in delivering a work of quality in virtual exchange? How do we move our trainings in virtual? There are some competencies that we don't have that we need to pick from people outside. I think one of the concrete advice that I can give is that we find more and more opportunities for different organizations and even for companies to bring their effort together, bring their expertise together, so that they can be able to do something very concrete.
Mm-hmm. Thank you very much. And I think there is a lot of also of efforts and guidance that's available on how we can add in humanitarian assessment, some key questions as well, so that you don't need to do a specific separate assessment, but you can add a few questions that help you monitor context of conflicts and how your response is also being received by the population whom you're trying to serve. We have 4 minutes to go before the end of this session. So I'd like to ask Lina a last question. The question is on the response from the donor side. And we have a question here about what would be the best behavior that donors should be adopting in responding to COVID, building on the lessons learned from the Ebola. What can they do to make the work of implementers and to make the work of the health authorities as relevant and as conflict sensitive as possible, Lina?
Great, thank you very much. The key lesson that we learned from Ebola in West Africa and DRC is that when there wasn't trust and legitimacy, that the health response was impossible to achieve. People were unable to deliver messages, to treat sick people, because those communities were not trusting and were not collaborating. So as we head into COVID, even though the medical dimensions of the sickness are different, that underlying aspect of how we change a society and how we trigger collaborative efforts that are so needed today remain the same. And so let us learn that lesson, that a medical only support will not be effective. It will lead to the loss of lives of more MSF people, as we saw in the DRC. Let us learn that lesson and strengthen the way that programs are funded that build trust, that engage dialogue, that connect people across dividing lines that either have existed prior to COVID or can be aggravated during COVID. Let us enable people to understand why they are suspicious, uncomfortable, or resisting the measures that have been put in place. And then let's help people to have the safe spaces to change when they're feeling like, okay, maybe they built a political reputation by saying, no, this is God's plan, and we don't have to follow anything the government says. Find discrete track 2 ways to engage those people so that they can come around, they can feel not humiliated, and they can join in this. Because this is up to us as humans and as communities to overcome. And if we collaborate, there really isn't a reason that while being aware of the risks, we can't overcome that. But if the funding and if our different sectoral approaches are all overvaluing each of our technical lanes, I think we'll fail. Thanks.
Thank you, Lena. And that was an excellent closing remark, I think summarizing a lot of what we've been hearing today, where we went over the challenges that we faced, the context where Ebola erupted in West Africa in 2014 and then later on in the DRC in 2018. Thanks to both of you, Laurent Cassindi, our Global Program Quality, Lena Slackmulder, our Senior Vice President of Program with Search for Common Ground, Peacebuilding organization active in 30 countries across the globe. Thanks for being here and sharing your insights, and also providing recommendation as to how to apply the lessons learned from Ebola to this new crisis, this new health crisis that is unfolding. I'm Charlene Burton, I'm the Europe Director with Search for Common Ground, and it was a pleasure hosting you. We'll be reaching out again to all of you who participated to this session, sending you the PowerPoint slide and also sending you the link to this virtual session that is going to be published on our website. I thank you all and I wish you a very healthy end of the day.